My name is Jonathan Fainberg. I'm a physician and a urologist, works at Memorial Sloan Kettering Cancer Center. My primary specialty is the diagnosis and treatment of prostate cancer, and my area of expertise is in focal therapy for treating prostate cancer. Irreversible Electroporation, which is known as IRE, is one of the modalities that we use to treat prostate cancer in the prostate and one of the ways that we perform focal therapy. IRE uses electricity to create holes in the walls of the cancer cells so that the cells die afterwards, and it's one of the many modalities we have to treat prostate cancer that's just contained to one part of the prostate gland. IRE is different than many of the modalities we use for focal therapy because it's athermal, or it doesn't create heat to kill. Typical ways that we do focal therapy are with temperature. We use freezing or heating to kill the cancer cells. IRE, as it uses electricity, doesn't create heat. IRE has a number of benefits. Because it's an athermal modality, there is less harm in terms of scar tissue or treatment effect outside of the prostate. The electricity gets to the capsule of the prostate and stops conductance there because the prostate is surrounded by fat. Theoretically, this leads to less scar tissue, and in the event that you needed surgery down the road, this can be quite beneficial. Additionally, because it's athermal and the electricity conducts around tubes instead of through them, like the thermal energies, it can be used to treat tumors that are very centrally located around the urethra, or tumors that are close to the rectum, which, when you're using the thermal energy modalities, can be quite difficult because damage to the rectum can be really a catastrophic consequence of focal therapy. So any energy that decreases the chance that you harm things is very beneficial in this space. The IRE procedure is typically a same-day procedure. You come in and you go home from the hospital on the same day. When you wake up from an IRE procedure, you have a catheter that drains your bladder. Usually this catheter will stay in for a few days after the procedure, anywhere from about 2 days to a week, depending on the surgeon's preference. Once the catheter comes out, most men will urinate, but some will have some differing urinary habits, some urgency and frequency of urination that we know goes away by 3 months after the procedure. Additionally, for the first few weeks after the procedure, it's normal to have some changes in your erections or your erectile function, and we know by 3 to 6 months after the procedure, men typically get back to 90% of their erectile firmness, and 9 out of 10 men are going to still be able to have erections if they started with good erections before the procedure. How effective is IRE in treating prostate cancer is an excellent question. The company has recently finished its pivotal trial examining that exact question here in the United States. We performed the final IRE procedure in the United States prior to the trial closing, and now we are awaiting the results. We're going to start to get results in the next few months to years regarding its efficacy in terms of cancer control. There are studies from other countries, like Australia, that show very good oncologic efficacy after IRE, meaning good cancer control, upwards of 90%, depending on the study that you look at, but it's variable and it depends on the experience of the practitioner.